I yield back.
And I think the gentleman from Ohio, and I point also in this map here, the Cincinnati area in southern Ohio, which is one of the hot spots in 2014, has continued to grow as a problem. We recognize this is both a local problem and a nationwide problem. And I want to tell a story here. Last December, when the President was signing into law 21st Century Cures Act, which included my legislation of the Helping Families in Mental Health Crisis Act, a former state senator from West Virginia took the stage to introduce it. David Grubb talked about his daughter, Jessie, who herself had been in rehab, in treatment something like 3 or 4 times, had had several drug overdose instances, and had been revived. But what happened to her also is part of what they called the loaded gun that never should have happened. She went into hospital for some surgery, but the doctors and nurses never told her discharging doctor that she was in recovery for heroin addiction. And the points we made before about the NASPR list or the other lists there or the 42 CFR blocks information from going into the medical record. So while someone was out to perhaps protect her privacy, they didn't protect her from death. She was given a prescription of 50 opioid painkillers. Remember I said before, when a person is given this prescription, they run the risk of relapse, overdose, or bad drug-drug interactions. In her case, it was an overdose that finally took her life. Another important reason we have to deal with this 42 CFR and get rid of that arcane and, quite frankly, deadly law. Let me talk about some other recommendations, what I believe Congress can do to help. The references made before with Dr. Bouchon and others about the prescription drug monitoring program, also Buddy Carter of Georgia mentioned this too, where a pharmacist, a physician can simply look and say, is this person on other opioids? Have they jumped across the border? Have they seen 4 or 5 or more physicians for some opiates? By having a better PDMP, the Prescription Drug Monitoring Program, or the National All Schedules Prescription Electronic Reporting Program, we have to make sure that all states use the same system, that it collects data from across borders so doctors can easily see this. But part of this, too, in dealing with the 42 CFR, is understanding the federal law prohibits including buprenorphine and methadone in the PDMPs. How absurd and how cruel that is, that a doctor would not even be able to know that a patient is taking one of those prescriptions. The thing is also that some of these drugs can be a respiratory suppressant, and when the patient takes another drug that is a benzodiazepine, can add to that effect and add to further complications. Another aspect, too, which we must be further engaged with is vigorous public education programs across all age groups, beginning with early elementary school. When schools have some of these programs, and we'll bring forth some models to talk about these programs in a future hearing I'll be holding in the Oversight and Investigation subcommittee. These are very, very important to help students early on understand the dangers of this. This is not just recreation, but it's so easy to slip into this, and given that 80% of drug abuse begins with a prescription, whether it's a student athlete or perhaps a football player who's injured their leg or something who's given some of these things, it is essential the whole family be counseled from the onset, understanding the concerns and dangers of continuing these on. We also have to have drug take-back programs and public education programs stressing the importance of proper disposal of unused opiates and pain prescriptions to prevent them from being stolen or misused. For example, if a family is selling their home and they're having an open house and strangers come into the house, and while they're there they say, "Can I use your restroom?" and the family lets them do that, don't be surprised that that person has no intention of buying a house, but has intention of going into those bathrooms, checking the medicine cabinet, and finding any medication and taking it. Also, when teens come over to the house for parties or socializing, don't be surprised if they also go into medicine cabinets, look in drawers in the bathroom or drawers in other places of the house looking for some of those drugs, which they themselves will take or sell. We have to make sure we have vigorous patient education programs about doctor-prescribed opioids to make sure people know about that before the addiction takes foot. And taking one of these prescriptions may only take 3 or 4 weeks before it begins to kick in as problems. I know myself, back in 2005, I was in a rollover accident in Iraq with a couple other members of Congress. Our vehicle rolled, and in that ended up myself having a mild concussion, snapping my neck, having some temporary paralysis, but a great deal of pain. Well, battlefield medicine is one that gets you out of the the area, stops bleeding, stops pain, and ships you off to some other hospital. And so that was the case for me. But I know what happened is everywhere I landed, in a helicopter, an ambulance, appropriately so, the physicians would ask me a number of orienting questions, but also say, are you in pain on a scale of 1 to 10? How much pain are you in? And when I proceeded to say that number immediately, as they would do for many other people in battlefield, administering morphine or some other pain relief to move you on from there. What happened, though, is returning to the United States, where pain continued for me, I was prescribed some pills for that pain, but also prescribed fentanyl. But never once was ever described to me, be careful with this is highly addictive, this is a problem. Now, after a few weeks on this and recognizing it was hard to even do my job because I couldn't keep my head clear, I just said, that's it, I'm not taking this anymore. But at that point, my body had already begun to develop some tolerance for this, and when I stopped taking it, I had some reaction. Now, granted, it's not as severe as some of those who've been taking some of these drugs at a higher dosage and longer. But I could feel myself actually saying, I understand what people mean when they say their skin feels like it's peeling off of them, and they feel a sense of nausea and other problems as well. Now imagine, I can't even imagine what it's like for someone who's taken higher dosage for longer periods of time. But it's extremely important that every time that prescription is written, that pharmacists have an opportunity to counsel patients, and doctors are also doing more than simply passing on a prescription. Pharmacists should have what Buddy Carter was saying before, make sure they have the person showing a photo ID. Is this indeed a prescription they're picking up for themselves or claiming they have it for someone else? Perhaps that prescription was stolen from someone. We have to make sure that we're also in understanding what this happened. For those who are out there trying to legalize marijuana, I caution you. Because this marijuana that is out there on the streets or being presented in many areas, it can cause tremendous problems with psychiatric problems for those who are already at risk for them, or the longer you're on some of the types of marijuana, the greater risk you have for things like delusional behavior. We have to make sure we also eliminate Medicaid payments for those question 14 responses I made reference to before when you're in the hospital to ask if the hospital adequately addressed your pain. In the area of treatment and recovery, we have to expand the mental health workforce. As I said before, half the counties in America have no psychiatrists, no psychologists, no social workers, no drug and alcohol counselors, and those who are out there likely have their schedule so filled they don't even have room to treat someone, and not all even know how to treat addictive disorders. The fact that a majority of people who may have an addiction disorder also have a concurrent mental health disorder is another reason why we have to increase this workforce by tens of thousands. Just for child and adolescent psychiatrists alone, we need another 21,000 of those. We need tens of thousands more psychologists. It is important that the schools of medicine, schools of psychology, schools of social work are graduating more people with these degrees and getting them into our workforce. I've had legislation before, and we passed some things in the Cures bill, in my mental health crisis bill, to provide more funding for more of these folks to continue with their education. It is essential. It's like trying to fight a war without soldiers. To try and fight this war, which is killing more people every year than the entire war in Vietnam. But we do not have the soldiers to fight this.